pain-free living. My name is Dr. Andrew Gorecki, physical therapist and owner of Superior Physical Therapy. And again, today we're talking about knee pain. If you're out there struggling with painful knees and you're looking for a natural solution, this is going to be the episode for you. I'm super excited to share with you the knowledge that I've gained over the past 10 years, working with thousands of people, helping them avoid surgery. And so even if you're out there struggling with it and you've been told that surgery is the only answer, I'm going to try to help you make some decisions and find some natural options that may help you avoid a surgery, which I think most of us out there, when we have a choice, and remember surgery is a choice, I think that we oftentimes want to try to do something that's not going to be as high risk and scary maybe as surgery. So let's dive deep first here and just kind of I'm going to describe to you what I hear from many people that are coming in to see me looking for help who have knee pain. And I myself have had knee pain in the past. I've been a knee pain patient. So I can relate. I have a little bit of empathy on how challenging it is and what life is like. So the biggest thing that I notice with most people that come to me with knee pain and are looking for help is that it hurts when they move. That's number one on the list. So that might most commonly includes walking, standing, going up and down stairs, getting in and out of their car, definitely bending and squatting. And so that includes a lot of things like gardening and housework and yard work. Sometimes even your work duties that you have, your job relies on you to be active, and if your knees are hurting you, that becomes really challenging. So I've met a lot of people that aren't able to go to work or had to do a different job because their knees are really just bothering them so much. And so it really affects all aspects of life. And then as we let knee pain continue and it progresses because most knee pain is actually what's called a gradual onset or cumulative trauma injury, which means that our body's not moving so good, and as time goes on, it starts to get a little worn out. And so time goes on, the knee pain gets worse, and what you start to notice is that people are creating a big list of things they can no longer do. You might relate to that. And that looks like, I can't do the yard work anymore. I can't clean my house anymore. I can't do certain work duties. I can't play with my grandkids. I don't like to travel anymore because I'm holding back the group that I'm with because I can't walk for long periods of time. I need to sit down and rest. And so I call that activity avoidance. The activities that we're avoiding become larger and larger. And ultimately what that does to us is that makes us dependent on other people. And so the longer that our knees are hurting, the worse it gets. You become more dependent on the people around you. And that's really you lose dependence or independence. That becomes a really stressful thing that can start to cause depression. Anxiety is oftentimes what I hear from people. And so not a good thing, not a good path to go down. So if you're out there struggling with knee pain, today's episode is going to help you at least understand what all the options are and have a better understanding of what the knee is designed to do, what goes wrong, and then what successful treatment looks like. We're going to talk about a lot of options today that you're going to have. So if you're out there and you've been struggling with knee pain, even if it's been for years, many people that I meet have been struggling for years, don't give up hope. There is hope. There's a lot of things you can do. You might be thinking to yourself, you've tried everything, but I can promise you right now that most people I meet haven't tried everything. And so today on the show, I'm going to try to talk to you about what you haven't tried. And so that's going to be the focus. I would also highlight the biggest thing that I see that kind of scares me with people that are dealing with knee pain. If you have knee pain, you're usually not moving very much. So you're not going to be exercising. When we're not moving very much, now all of a sudden we start to get a high risk for other diseases. And commonly you'll see it'll increase your risk for heart disease, diabetes, depression, obesity, and cancer. All of those things are really major life-threatening things that are at a higher risk because we're not exercising, we're not moving as much as we used to. So I want to focus on that. That's really the big driver for me to try to help you today, finding a natural solution to knee pain.